Module 9:1 Health and Safety Protocols to the Daycare Industry. Establishing robust health and safety protocols is crucial to ensuring the well-being of children and staff members in your daycare center. Here are some key steps to consider. Develop a health and safety policy. Create a comprehensive health and safety policy that outlines your center's commitment to maintaining a safe and healthy environment. Include guidelines on hygiene practices, illness management, emergency procedures, and other relevant safety measures. Communicate the policy to staff members, parents, and other stakeholders. Implement hygiene practices. Establish and communicate clear hygiene practices to staff, members, and children. Promote regular hand washing with soap and water, especially before meals, after using the restroom, and after sneezing or coughing. Provide hand sanitizers or hand washing stations in appropriate areas. Teach children proper respiratory etiquette, such as covering their mouths and noses with a tissue or their elbow when sneezing or coughing. Ensure a clean environment. Establish cleaning protocols to maintain a clean and sanitary environment. Develop a cleaning schedule that includes regular disinfection of high-touch surfaces, toys, and equipment. Use child-safe and non-toxic cleaning products. Train staff members on proper cleaning procedures. Illness management. Establish clear policies and procedures for managing illnesses in the daycare center. Develop guidelines for when children and staff members should stay home due to illness. Communicate the policies to parents and enforce them consistently. Maintain appropriate records of illnesses and communicate any outbreaks or contagious diseases to relevant authorities as required. Emergency preparedness. Develop emergency response plans for different scenarios, such as fire, natural disasters, or medical emergencies. Conduct regular drills to ensure staff members and children are familiar with emergency procedures. Maintain updated emergency contact information for children and staff members. Ensure the presence of appropriate safety equipment, such as fire extinguishers, first aid kits, and emergency exits. Staff training. Provide comprehensive training to staff members on health and safety protocols. Cover topics such as hygiene practices, emergency procedures, illness management, and child supervision. Ensure staff members are trained in first aid and CPR, child supervision and security. Establish clear guidelines for child supervision to ensure their safety at all times. Implement secure check-in and check-out procedures to prevent unauthorized access. Monitor entrances and exits to the facility and ensure they are properly secured. Conduct background checks on all staff members and volunteers as required by local regulations. Regular inspections and audits. Conduct regular inspections of the facility to identify potential hazards and address them promptly. Schedule periodic audits of health and safety protocols to ensure compliance and effectiveness. Involve staff members and parents in the inspection process to gather feedback and address concerns. Ongoing communication and education. Maintain open and ongoing communication with parents regarding health and safety practices. Provide educational materials to parents on topics such as illness prevention, child safety, and emergency preparedness. Organize workshops or seminars for staff members and parents to enhance their knowledge and skills in health and safety practices. Stay updated on regulations. Stay informed about local health and safety regulations and guidelines related to daycare centers. Regularly review and update your health and safety protocols to align with the latest recommendations and requirements. By implementing robust health and safety protocols, you demonstrate your commitment to providing a safe and secure environment for children and staff members in your daycare center. Regular monitoring, staff training, and ongoing communication with parents are essential to maintaining a strong culture of health and safety. Implementing policies and procedures for illness prevention, emergency preparedness, and hygiene practices is crucial to maintaining a safe and healthy environment in your daycare center. Here are some key considerations for each area. Illness prevention, sick child policy. Develop a clear policy outlining when children should be kept home due to illness. Include specific symptoms or conditions that require exclusion, such as fever, vomiting, diarrhea, or contagious diseases. Communicate the policy to parents and enforce it consistently. Immunization requirements. Establish immunization requirements for children attending your daycare center. Request proof of immunization records from parents during the enrollment process. Comply with local regulations regarding immunizations. Health screening. Conduct health screenings upon arrival or during check-in to identify any signs of illness in children. Screen for symptoms such as fever, cough, runny nose, and rash. Encourage parents to report any illnesses or symptoms their child may have. Hand hygiene. Establish a hand-washing policy that promotes regular hand-washing for children and staff members. Teach proper hand-washing techniques and make hand-washing stations easily accessible. ensure hand sanitizers are available in appropriate areas, such as entrances, classrooms, and dining areas. Respiratory etiquette, educate children and staff members about respiratory etiquette, including covering their mouths and noses when sneezing or coughing. Encourage the use of tissues or elbows for covering coughs and sneezes. Provide and properly dispose of tissues in classrooms and common areas. Emergency preparedness, emergency response plan. Develop a comprehensive emergency response plan that covers various scenarios, such as fires, natural disasters, medical emergencies, or lockdown situations. Clearly outline evacuation procedures, designated assembly areas, and emergency contact information. Assign roles and responsibilities to staff members during emergencies. Emergency drills. Conduct regular emergency drills to familiarize staff members and children with evacuation procedures and other emergency protocols. Practice drills for different scenarios, such as fire drills or severe weather drills. Review and update the emergency response plan based on feedback and observations from drills. Communication and notification. Establish effective communication channels for emergencies. Ensure staff members know how to communicate with each other and with emergency services. Maintain up-to-date contact information for parents and emergency contacts. Develop a notification system to inform parents of emergencies or closures. Hygiene practices, cleaning and disinfection. Develop a cleaning and disinfection schedule for different areas of your daycare center. Use child-safe and effective cleaning products. Pay special attention to high-touch surfaces, toys, and equipment. Food safety. Establish procedures for safe food handling, storage, and preparation. Ensure compliance with local food safety regulations. Train staff members on food safety practices. Personal protective equipment, PPE. Determine the appropriate use of personal protective equipment, such as gloves or masks, in specific situations. Train staff members on proper PPE usage and disposal. Health and hygiene education. Provide ongoing education to staff members, children, and parents about health and hygiene practices. Offer workshops, training sessions, or informative materials on topics such as hand washing, personal hygiene, and illness prevention. Regularly review and update your policies and procedures to align with current best practices, local regulations, and recommendations from health authorities. Communicate these policies effectively to staff members, parents, and children to ensure everyone understands and follows the guidelines for illness prevention, emergency preparedness, and hygiene practices.